We are continuing to highlight Breast Cancer Awareness Month, talking about prevention and treatment options. I am joined now live by Neha Sarvepalli, a breast cancer surgeon with Premier Health. Doctor, thank you so much for joining us.
Thank you, Lauren, for having me.
And now breast cancer awareness is, of course, important every year, but recent data from the National Cancer Institute shows that early onset cancers are increasing, especially in young women. What are you seeing in your practice?
Unfortunately, we are seeing increased risk of breast cancer in younger women. We can attribute that to a few things. One is that younger women are just more aware of breast cancer and are being proactive in getting their mammograms, which is great.
What are some of the theories about why exactly that's happening aside from the awareness?
Sure. There's multiple theories. Some of what we can say is that there's definitely increased estrogen exposure in younger women than there was 20 plus years ago. Women are choosing to have babies later in life, choosing not to breastfeed, which can contribute. There's been an increase in obesity among the younger population. And we're also noticing that there's more genetic mutations that's screening people in for breast cancer.
I know breast cancer can affect both women and men. What do men need to do to stay aware and get screened?
That's a great question. So in men, breast cancer is exceedingly rare still. I would say that men that are higher risk for breast cancer, so they have a family history of BRCA1 or BRCA2 mutation and have been diagnosed with BRCA1 or BRCA2, should consider getting screening mammograms starting at the age of 50, or at least undergoing a breast cancer or breast exam. Other than that, I would say that if you notice a mass or a lump, man or woman, you should try to reach out to your physician to at least start the process of getting imaging completed.
And when should women start getting regular mammograms, and how regularly should they do that?
Sure. So our guidelines from the American Society of Breast Surgeons tells us that we should get mammograms starting at the age of 40 and yearly thereafter. There are women that are higher risk because of family history or dense breast tissue that would qualify for screenings younger in life, or getting 6-month imaging with mammograms and MRIs. So I would encourage everyone to talk to their doctors to see if they would be qualifying for a high-risk screening.
Can you talk us through at-home screening that women can do themselves?
Sure. Screenings at home, I would say pick a day of the month, usually at the end of the period for women that are premenopausal, or the first of every month, and do an exam both sitting up and laying down, because the breast changes based on that. And start either from the areola and work your way out in circles, or go down in rows, and just be very aware of what you're feeling. Breast cancers tend to feel like the back of your knuckle, tend to stay very immobile. They're fixed and they don't move, and they're not soft. Other lumps tend to be softer and they tend to move with the rest of your breast tissue.
All right, Dr. Neha Sarvepalli, a breast surgeon with Premier Health, thank you so much for joining us today.
Thank you for having me.